Of all of the things that you have achieved, and there are so many, could you pin down one that you are most proud of professionally?
I've been doing research in child health for the last 63 years, but my best achievement really lies in founding with Ron Cowie and Rotary the charity now known as Cure Kids.
Years ago, a great man had a very bold vision.
When you think about how it started, two keen, very committed paediatricians in Auckland just saying to one another and to their professional friends and colleagues, something's got to be done specifically for New Zealand kids to back research that specifically is about them.
Cure Kids is the largest funder of child health research, and we're a charitable fund, so we do this with the generosity of our beautiful donor community. Our children have a really high incidence of respiratory disease, of oral health problems and skin infections that could be treatable before they even have to be admitted to hospital.
Each year, probably 300,000 children are admitted to New Zealand's emergency departments. The children that do worse in our health statistics, so Maori, Pacific, those who live in the most deprived parts of our society, present more commonly. And it's these children that the research is serving that's being supported by Cure Kids.
So my research focus is upon children with inflammatory bowel disease specifically. The conditions that I look at are things that are increasing quite dramatically in terms of the numbers of kids. They're incurable and they can lead to lots of impact upon the child, their family, and not just in childhood, but right through the rest of their life as well.
We have this awful scourge of rheumatic fever across New Zealand. It's a third world disease. There are very few countries throughout the world that have rheumatic fever rates as high as we do here in New Zealand.
A lot of young people who have mental health problems never get the help that we know might be effective. My focus has been really on making evidence-based therapies more readily available across New Zealand for all young people.
Cure Kids has a scientific advisory committee, and the key role of that committee is robustly looking at research proposals that come through. So I think one important thing to get across is that though Cure Kids funds research in the child health space, what they do is they support high quality research.
Professor Ed Mitchell and Dr. Christine McIntosh have had a 25-year program of research looking at all of the risk factors that may put a baby higher at risk for cot death or sudden unexpected death in infancy.
250 babies were dying of cot death every year. We talked to what was then the Department of Health, now the Ministry of Health, about this and developed a prevention program, and within 2 years they had fallen to 120. Cure Kids was really important in this because they funded a lot of the materials. Not only have we saved thousands of babies' lives in New Zealand, but we've saved tens of thousands overseas.
I think it's really, really important that we're still continuing to research SUDI because it is the most awful, tragic thing to happen for a family. It really, really affects the whole wider whānau when it happens.
Since I've been working here in Dunedin for the last 20 years, supported so beautifully and so well by Cure Kids, we've found multiple different answers for so many different families, not just from New Zealand but from around the world, for dozens, in fact scores of different conditions that fall into this category of rare genetic disorders.
The most common condition that we see in paediatric emergency medicine, and indeed paediatrics itself, is bronchiolitis. And we now have research which is being funded by Cure Kids, which is a large project that we're leading across Canada and Australia and New Zealand, which is focusing on preventing those children deteriorating when they do come into hospital.
Child health research is vitally important because we've got so many unanswered questions. 40,000 children a year are admitted to hospital with completely preventable illnesses. So we've got to figure out why that is.
People often ask, You know, why are we doing the research in New Zealand? Why not just import the results from somewhere else? We've got a unique population, a mixed population. We've got some, you know, to address issues that could only be done here that would involve things like Maori health.
Overseas, people have developed really good genetic tools to be able to diagnose genetic conditions in children with European ancestry. But for those who have Pacific ancestry or Maori ancestry, our tools are way less developed. We don't have the tools that we should have to be able to do as well for Maori and Pacific children as we do for European ones.
We are trying to improve the health status of really our most vulnerable group within society.
We need to work hard in terms of overcoming these obstacles for the children now who will become the adults of the future.
Big research makes a difference to little lives.
I've got this amazing team who work with me at Cure Kids, who are on a real mission to make sure that we can fund the biggest and best research for little lives. But you can help too, and help us accelerate the impact that we have and make sure that every Kiwi kid has the opportunity to have a healthy, bright future.